Hello everyone, I'm happy to present my research paper entitled The Commitment of Health Workers and the Effect of Transformational Leadership and Charismatic Leadership during the COVID-19 pandemic. This is the research collaboration between Binus University Indonesia and Unimas Malaysia. We began with the abstract. The purpose of this study was to determine and analyze the effect of transformational leadership and charismatic leadership on commitment to health workers during the COVID-19 pandemic. The approach used in this study is a quantitative approach. The population in this study were the health workers who served in hospital, both private and government hospital, in several cities in Indonesia, with the respondent 367 health workers. The data collection technique was used, the survey method with the analysis was used, the multilinear regression. The result of the study found that the transformational leadership had a direct positive effect of 4.4% on the commitment of health workers during the COVID-19 pandemic. Meanwhile, the charismatic leadership directly has a positive effect of 5.7% on the commitment of health workers during the COVID-19 pandemic. Simultaneously, the transformational leadership and charismatic leadership has an impact of 18% of the commitment of health workers during the COVID-19 pandemic. Currently, as we know, the world is facing and struggling with the COVID-19 pandemics. World Health Organization (WHO) has recorded that 110,749,000 were confirmed positive for COVID-19, including 2,455,000 reported deaths. The health workers are a person who are at the forefront in the medical field and are fighting against the massive spread of COVID-19. Therefore, the commitment of health workers is very essential to the maintenance of high quality safety and environmental health. So the commitment that begins with a reflection of the leadership will later become a model for subordinates or other members in the organization. And therefore, this research uh, examines the transformational leadership and charismatic leadership to the commitment of the health workers during the COVID-19 pandemic. We go to the literature review. Transformational leadership shows how leaders change a team member or organization by creating, communicating, and modeling a vision for the organization or work unit and inspiring workers to strive for excellence and to achieve that vision. Transformational leadership also describe how effective leaders inspire their followers and also transform them by appealing to their ideals and their emotion for better outcome. Meanwhile, charismatic leadership style is a leader who has charisma and authority and a mindset that is consistent in carrying out the vision and mission in an agency or organization. Leaders with charismatic leadership show and help their followers to change many aspects for the better, such as their needs, values, preferences, and aspirations to become more committed to the organization mission and to work beyond expectation. Commitment is an employee's loyalty to the organization. Commitment has many aspects. It includes loyalty, pride, a sense of commitment to work, and belief in the organizational values. Now we go to the method. This research method uses a quantitative approach with the survey method. The sampling technique used is a convenient sampling technique, which is a sampling technique based on the ease of research by distributing questionnaires to respondents. There are 367 health workers who participated in this study. And for the data analysis, we use the multiple linear regression for the data analysis. Now we go to the results of the study. We can see from the table that both transformational leadership and charismatic leadership has a positive influence to the commitment of the health workers. We see that the transformational leadership has a significant and positive impact of 0.044, which means that 4.4% of the effect on commitment. And meanwhile, charismatic leadership also has an effect of 0.057 or 5.7% of the impact on commitment. Simultaneously, both transformational leadership and charismatic leadership has an impact to the commitment of 0.182, which means that 18% commitment can be explained by the transformational leadership and charismatic leadership. We can see to the on the figure, both transformational leadership and charismatic leadership has a positive and significant impact to the commitment. We go to the discussion. Leadership is a dynamic mutual relationship between two parties, leaders and followers, which result in a better effort for motivation and technical development. Two types of leadership that have become key recently are transformational leadership and charismatic leadership. Transformational leadership has been found to be one of the most important aspects in the organization because transformational leaders basically move employees to go beyond their own interests for the good of the group. Transformational leaders support their followers to feel more trust, admire, loyal, and respect to the leaders. And they are motivated to do more than they expected to do. Meanwhile, charismatic leaders have a deep and unusual impact on followers. Subordinates feel more that the leader's self-belief are true. So as a consequence, they accept the leader without questioning. They submit happily and they love the leader. Charismatic leadership behaviors such as a sensitivity to members and having a clear vision were positively related to the effective commitment in organization. Based on the result of the study, it was found that transformational leadership and charismatic leadership had a positive effect on commitment to health workers during the COVID-19 pandemic. We go to the conclusion. Simultaneously, based on the research results, there is an influence of 18% between transformational leadership and charismatic leadership on the commitment of health workers during the COVID-19 pandemic. Spiritually, transformational leadership has a positive impact of 4.4%. Meanwhile, the charismatic leadership has an impact of 5.7% to the commitment of health workers during the COVID-19 pandemic. The limitation of the study are that the distribution of the respondent is more dominated by women and the majority of service locations are in private hospitals. Regardless of the research limitation, this study offers an interesting academic contribution related to the leadership style and could be used as a literature review for further research. And these are the references on this study. Thank you.